It's fine. Yeah.
So thank you for the introduction, Mikel, and thank you, the organization, for the opportunity to be here today. I'm Aina Turull, and I'm a PhD student in Universitat Politècnica de Catalunya. And the work that I'm presenting today is the first step inside my PhD thesis that is related to the study of the accommodation during refraction and the development of new technologies for refraction. So talking about refraction, we can define refraction as the process of measurement of the ocular refractive error to correct the ametropia, achieving the best visual acuity and with the minimum accommodation. I want to emphasize that it has to be with the minimum accommodation because a good control of accommodation is a key factor when assessing refraction. With a good control of accommodation, we will prevent to hypercorrect or undercorrect our patients, and hence we will avoid them to have asthenopia. Besides, this control of accommodation is as important in the traditional optometric exam as in the new technologies, automated technologies for refraction. In the clinical practice, we have two methodologies of control of accommodation that are commonly used. On one hand, we have cycloplegic drugs. Cycloplegic drugs give a solid prevention of accommodation. However, they cause some discomfort to our patients because they cause blurred visions. Besides, they need of a trained clinician to be instilled. And in some countries, there are limitations in the installation of cycloplegic drugs that has to be done with the supervision of an ophthalmologist. On the other hand, we have the fogging technique, that is the topic that I will be talking today. And the fogging technique consists in the use of spherical positive power lenses. And since it is a non-invasive method and it does not need a trained clinician, it is a fit for automated system. However, there's an issue with its methodology that it's not clear. Authors differs in the amount of fogging power that has to be used in a range from 0.75 diopters to +6 diopters. Some authors suggest that this amount of positive power has to be in agreement with a reduction of the visual acuity until reaching values between 2000 and 2020. Besides, regarding the time that these lenses has to be in front of the eye, none of the authors specifies this time. For that, the purpose of our work was to study the accommodative response when different fogging lenses were played with different fogging lenses, and to find which lens and application time are more suitable to achieve a successful relaxation of accommodation. So our participants were young adults between 18 and 30 years old, and here we can see the exclusion criteria. We were looking for young adults with good vision, with spherical emetropias between 3 diopters of hyperopia and 5 diopters of myopia. Those subjects with astigmatisms over 1.50 diopters were excluded, and also those with anisometropias higher than 3 diopters. Also, those who had amblyopia, strabismus, nystagmus, that were orthokeratology lenses, had previous ocular surgeries, or had, of course, anomalies in accommodation values, were excluded too. So our setup was a Hartmann-Shack aberrometer that had been developed in our lab previously, and here we can see the optical design. It has a measuring frequency of 10 Hz, and in this picture in the right, we can see how the actual system looked like. It can be coupled to a lens holder, as in this picture, or to a phoropter, and it works as an open field instrument. In the specific case of this student, we wanted to measure the changes in accommodation in the contralateral eye on which the lenses were placed. So we used a dark box in order to occlude the left eye and without and not interfering with the measuring system. So we put the lenses in the right eye and we measured the accommodation in left eye. So regarding the measurements, we measured the accommodative response when wearing the fogging lenses in the corrected eye, and while the participants were staring at a visual acuity chart that was placed at 6 meters. The total measurement took a total time of 70 seconds, of which the first 10 seconds were without the fogging lens, and the remaining 60 seconds were with the lenses. The lenses that we test range from +1 diopters to +5 diopters, and they were presented in a random order. When we finished the measurement with one of the lenses, we left a wash-up time of 90 seconds in order to our subjects to rest and for the accommodation to return to the normal state. So when we did a measurement, we obtained data that looked like this one in the graphic. Here we can see the measured spherical equivalent in function of the time of measurement. As I said, these 10 first seconds correspond to the period without the fogging lens, and the remaining 60 seconds with the fogging lens. Since here we have a lot of data and we wanted to filter data from the microfluctuations of the accommodation, we divided this data in frames of 5 seconds, and for each frame we obtained the median value. Here in this graphic we see the median of the spherical equivalent, but we wanted to see how the accommodation changed. studying the behavior of accommodation during subjective refraction in order to be capable to provide methodology that can monitor accommodation in real time in order to improve the refraction assessment. So thank you so much for your attention.